DocTalk is brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
Hi there, welcome to DocTalk today. I'm Dr. Dan Thompson. We're glad that you joined us. We're going to have a great show, What's in Your Medicine Box? And we're going to be talking with Dr. Mike Apley, who's a professor here at Kansas State University's College of Veterinary Medicine. Stay tuned and enjoy the show.
I'm Dennis Tebow. My wife and I, Kathy, are the owners of Wolf Creek Cattle Company. We have grown to approximately 70 bulls.
I'm Reese Arnold. I'm the livestock manager at Wolf Creek Cattle Company. You know, these are not just like normal cattle. These cattle, they're hauled anywhere from, 8 to 10 hours a day across the United States and asked to perform. The Multimin 90 keeps them kind of level. It maintains and balances their system. The stress level is less when, when everything's right and working right, then they're working right.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value. This segment is brought to you by Rotomix, manufactured in the USA and designed for feeding performance in the feedlots, beef production, dairy, and cow-calf operations.
Mike, welcome to the show.
Thanks.
It's always good to have you here. Folks, this is Dr. Mike Apley. He is a professor here at the College of Veterinary Medicine. He's a clinical pharmacologist and a world-renowned expert in food animal clinical pharmacology and veterinary medicine. And today, we're going to talk about what's in your medicine box.
You bet. I thought we'd start out a little bit. I was in, the farm store the other day, walking around looking for some stuff, and so I stopped by the drug aisle and noticed, there's still quite a few drugs available over the counter. We can buy some vaccines, we can buy some antibiotics. So I grabbed a bottle, and I wanted to talk a little bit about the information that's actually on here to start, because we tend to think about the label and we think maybe it's this on the back, and there's a lot of good information on the back of a bottle or the box. So this has warnings with the slaughter withdrawal, but it's important to realize that withdrawal time only applies if you use it exactly as on label. So this is an example, LA200, one you can buy at the feed store.
Yep.
Called over the counter. But if you use it different than is specifically put on the box or on the bottle, then you have to have a prescription for that. And one of the things it could end up doing if you use it different is to have a violative residue, and in that case, if you didn't have a veterinary prescription, it's not going to be a fun day. So there's also a label on the bottle, and I've just learned recently that a lot of the animal drugs have gone away from having an extra paper insert, and now what you do is you peel away this, and there's all the extra information. So you can read about
Good grief.
everything that's in there. So there's a lot of information there, and if you're going to use a drug, you should be familiar with that. And it's one of the things we teach vet students is when you start practice, you should start reading the labels of everything you use. And again, an over-the-counter drug is labeled this way because adequate instructions can be put on the bottle so that a lay person can use it appropriately. This antibiotic was labeled quite a few years back. All the new ones will be prescription.
I can remember when it came out.
Yeah, me too. Yeah.
Date ourselves a little.
Yeah. So that's just an example of some of the information that's on there. And again, reviewing that's the directions that you have to adhere to. A veterinarian is able, under law and regulations, to prescribe an extra label dose, but that's only legal to do if you are working in a veterinary client-patient relationship with a veterinarian. So,
Right, and they have a direct insight to the case, and they've seen the animal and
you bet.
been on the farm and to that nature. So what are the things we're looking for on the label?
Well, like I'm always curious to the ingredient. It'll tell you what the drug is, but then there's also the indications or the diseases that you can use it for. And then there's the regimen. So how much to give, how often, where to give. And this particular product even has a diagram on there on the injection site triangle and where to give it and things like that. And then also warnings, which could be any potential health problems for you or potential health problems for the animal, and especially the withdrawal time for slaughter.
When we come back, we'll touch a little bit more on the withdrawal. But This is really interesting information. Thanks for watching this morning. We'll see you in a minute.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information. Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300LA from Norbrook, specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle. Noromycin 300LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300LA is the practical choice for your herd.
This hog is head over hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
You know just how costly BRD can be, but did you know that bacteria like Mannheimia and Pasteurella can cause BRD? That's why veterinarians and cattle raisers focus on preventing pasteurellosis with a quality vaccine like Pulmogard PHM1. It's ready to use, highly syringeable, and provides comprehensive protection with a single dose. For pasteurellosis protection that's truly the head of the class, ask your veterinarian about Pulmogard PHM1.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by Norbrook Laboratories, manufacturers of Noromycin LA, Normectin Plus, 1%, and Poron, the practical choice for your herd. Hi there, folks. Welcome back to DocTalk. Dr. Dan Thompson here with Dr. Mike Apley, and we both teach here at the College of Veterinary Medicine at Kansas State University, and we're talking about what's in your medicine box. And we went through label directions and understanding OTC or what we buy. Now we're going to take it home.
Yep. And so when you take it home, you have to store it.
Right.
And you can harm drugs or vaccines with excessive heat or cold. So any drug shouldn't be stored in excessive heat. And it'll talk about on the label, but usually when you start getting above 90 degrees, it's not a good idea. We use coolers when we go out with vaccines. It's a good idea if you're going to have drugs out all day too, to keep them in some type of temperature and controlled environment. So example, if you have drugs in your pickup and you're going to go to town and roll it up on a hot summer day and it's going to hit 130, 140 degrees inside that closed vehicle, it's not a good place for drugs to be, and it's not a good place to keep drugs for a lot of reasons. People use refrigerators and keep their vaccines in them. One of the things to remember during the winter is that things can freeze in a refrigerator. Yep. And so we have a refrigerator out in a treatment shack that's not properly heated. We can actually have vaccines, frozen vaccines in there. And a lot of these vaccines that are pre-mixed, the ones that you don't have to reconstitute, a lot of the killed vaccines, etc. You freeze those, you're done a lot of times, and you shouldn't use them.
Modified live become modified dead.
Dead. And there's a couple ways to make modified lives modified deads. And one way is to mix up a bottle, mix up a 50-dose bottle. We only needed 20 doses out of it. And I've seen this happen. You put it in a refrigerator and you go the next day and you use it again. Those vaccines are good for a maximum of 3 hours, most of them. And you should be aware of your drugs, your vaccine-specific requirements. But I like to mix them up and use them immediately.
What about UV light?
When in doubt, don't expose it. A lot of these drugs have specific packaging for blocking UV light, but it doesn't mean we have to test the packaging. So I like to keep things away from windows. I like to keep them covered. If it's a drug that doesn't require refrigeration, it's good to have it in a closed cabinet.
I even heard earlier today that the UV light on antibiotics and
some of them
anti-parasiticide, ivermectin type products that can denature them. Is there anything else I can do, like to the syringe to activate a modified live?
You know, we like to try to reuse things, but one of the best things you can do with vaccines is if you're using disposable syringes, and just use a new one.
Okay.
If you're going to clean them, it's hot water rinse, and then make sure there's no debris in them. But if you use a disinfectant, like some of the blue liquids, chlorhexidine we use, if you leave any residue of that at all in the syringe, you will kill a modified live. So you are giving the diluent, the water that it's diluted in, to the animal, and you're getting no benefit at all.
Well, I think it's some great information on how to keep things cool, how to keep things heated, UV light, all that. When we come back, we'll move on to needles and syringes.
Oh, yeah.
It's good to have you here. Folks, thanks for watching DocTalk. We'll be back in a minute.
This tip brought to you by Baytril 100 Enrofloxacin Injectable, now approved for use in controlling BRD in high-risk cattle. Baytril 100, right the first time, whether it's controlling BRD in high-risk cattle or treating BRD.
Hi folks, it's Dr. Dan from DocTalk. Thanks for joining me for today's On the Farm tip. We're going to talk about extra labeled drug usage. Labeled drug usage is when I pick up the bottle, there's a label on it. And when I look at the label, it's going to tell me how much to give, how often, and the route of administration. Route of administration might be sub-Q, IM, or intravenous. Now, anytime you change the route of administration, or if you change the dosage, or you change the time in which you give those drugs, that's called extra label drug usage. We can't do that without the written consent of a veterinarian. So we need to follow label directions. If we don't follow label directions, we can wind up with antibiotic residues in the meat. And so when we do an extra label drug usage, we need the veterinarian involved. Thanks for watching today's On the Farm tip. I'm Dr. Dan, and I'll see you down the road.
With BRD, every second counts. And when you get new high-risk cattle, you've got a choice to make. You can either take your chances and wait and see what happens, or you can take charge of BRD. Right from the start, treat bacteria up front with Baytril 100 Enrofloxacin Injectable, now approved by the FDA for BRD metaphylaxis in high-risk cattle. Ask your veterinarian about Baytril 100 and make it your go-to drug to control BRD in high-risk cattle or for treatment of BRD. Baytril 100, right the first time.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Jason Lewis. I work here on Division Ranch, north of Strong City, Kansas. We run 500 head of mama cows. We started using multi-min about a year ago. We didn't have any problem with health that year. Didn't have to doctor near as many in that pasture. Just the overall appearance was a lot better. And I liked it so well, we'll start using it on everything.
This segment is brought to you by Lalaman Animal Nutrition, dedicated to the development and production of natural and differential solutions for animal nutrition.
Hi, folks. Welcome back to DocTalk. Dr. Dan Thompson here with Dr. Mike Apley. And Dr. Apley is a professor here at Kansas State University's College of Veterinary Medicine in the Department of Clinical Sciences. He is a boarded clinical pharmacologist. And today we're having fun with a segment talking about what's in your medicine box. And we've talked about what's on the label in the bottle, storing your vaccines and your antibiotics and other drugs. And now we're going to talk a little bit about needles and syringes. And Dr. Apley, you do this, talk or process with many different groups. But what do we need to know about needles and syringes?
Well, I do those talks, but one of the things that's taught me the most is having my own farm, and I've got my drug room.
Right.
And so you learn from, those, like a 60 cc syringe, they aren't cheap anymore. You get one of the plastic ones, and so you go, I'd like to reuse that. So it's reasonable to reuse them a little bit. Like if I give a shot of antibiotic to a cow, I'll label that with the drug I've got in there, because really under no circumstances should you use a syringe for different drugs.
Okay.
I'll make sure the outside's clean, and then to protect the inside, I'll cap it with a new sterile needle and then keep it back. I never try to hold a syringe with the hub open without a needle on it to use it again. So the needle size, I like 16 gauges for when I do a subcutaneous administration in a cow. Even with really good restraint, I don't use many 18 gauges, because I will with a modified live viral vaccine that's water. water
Right.
consistency. But if you're going to use an 18 gauge, you really need to make sure they're well restrained, because we do not want broken needles in our product. And so the 18 gauges are more likely to do that. The only time I use a 14 is for IV. If we have a product that we need to use a 14 gauge for to put under the skin, or in the rare cases we still put stuff in the muscle, we ought to really look at other products, I think. It's just an awful big needle. So the needles, how often should you use a new one? I don't treat animals every day on my small farm, but when I do, I usually get a new needle out. They're 15 to 30 cents, depending on what kind you buy and where you get them. To have a new needle that I know has no burr on it, is sterile, and then also I need to go into that bottle of medicine and pull it out. And I like having that new sterile needle on there to go into that bottle, because I want to be able to use out of that bottle again. And I don't want any contamination. I don't want injection sites. I don't want any problems. So when in doubt, new syringe, new sterile needle, go into the bottle and pull out. And
what about getting rid of needles?
Well, I use the either a designated container for that, one of the red ones, Sharps container, or I use a bottle, and a plastic bottle with a cap, and I fill it up, and when I'm done, I tape that up. You hear people putting epoxy in them, etc. I suggest people talk to their veterinarian about how best to dispose those and where to do that in their community.
Veterinarians are getting rid of Sharps all the time in the hospitals and doctors' offices. As far as cleaning, we got about 30 seconds before break, but as far as if they're going to clean, like your draw-off assemblies.
What I like to do with the draw-off assembly, which is the tube that comes down to a repeating syringe, I like to have sterile water for injection on hand and use that only to clean them, no disinfectants. And when I'm done with them, pump it out, pump probably 100, 200 mils through it, set it on 10 cc's and pump it. And then I leave that in there, cap it with a new sterile needle, clean it, wrap it in a bag, refrigerator until next time.
Great information. Folks, when we come back, we're going to wrap up with Dr. Apley and talk about why you need to know your drugs. You're watching DocTalk, and we're glad you joined us.
This segment is brought to you by Purple Wave Auction, the easiest, most straightforward way to sell used equipment. Purple Wave. Straight, simple, sold.
Dr. Sunny Ramaswamy, director of the USDA's National Institute of Food and Agriculture, or NIFA, was on the K-State Manhattan campus to present a special seminar entitled Setting the Table for a Hotter, Flatter, More Crowded Earth. The seminar is essentially a global view of food and agriculture and the transformative technologies needed to meet future challenges.
But the United States, we have a demonstrated ability to feed the world, provided that we have the right resources, monetary and intellectual, and you bring together the best. I like to call it crowdsourcing. Not just the federal government or the state government, but private sector, non-governmental sector, and all of these coming together, crowdsourcing the intellectual and monetary resources. I think we can do it.
Dr. Ramaswamy, he is the director of the USDA's National Institute of Food and Agriculture.
Cow-calf, stocker, and feedlot producers know that effective parasite control improves overall herd performance and profitability. Norbrook offers a comprehensive, economical line of pour-on and injectable parasiticides for every livestock operation. Consult with your local animal health supplier and set up a program that protects your investment and brings larger cattle checks this fall. See for yourself why the Noromectin line from Norbrook is the practical choice for your herd.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
Dr. Dan here. Whether I'm driving up and down the roads covering the state of Kansas or I'm getting between Riley and Manhattan for my job, I'm driving a Ford truck. I'd like you to come out and visit my friends here at Dick Edwards Ford. They have a truck that'll suit your needs, whether you're looking for power with a Power Stroke diesel, or if you're looking for fuel efficiency with the new EcoBoost engine, they got a truck that's just right for you. They're located 2 miles east of the Town Center Mall in Manhattan, Kansas, and they'll bend over backwards to help you. And I'll see you down the road.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hi there, I'm Dr. Dan Thompson. Welcome back to DocTalk. I'm joined by Dr. Mike Apley, who's a professor here in the Department of Clinical Sciences at Kansas State University's College of Veterinary Medicine. And Mike, it's always a pleasure to have you on the show, and today has been just that. And we're talking about now needing to know your drugs, and specifically we're talking about the prostaglandins. But what are some of the things about knowing your drugs and knowing what you're putting in the fridge and where you're placing it?
Yeah, well, storage, as we've talked about, how to store it, how you're going to use it. And then some drugs have a heightened need for safety. And one example is the prostaglandins, which a lot of our listeners may have on the place for reproductive purposes, using to, for example, synchronize a cow.
Yeah, Lutalize, Prostamate,
yeah,
those types.
And there's two things to know about those. One is they're very, very dangerous to pregnant women. And there have been cases where just skin contact of a few drops have caused a lady to lose her pregnancy. So it's some people just have a policy that females are not allowed to handle this drug, because, especially of certain ages, because you just never know. Sometimes someone may be pregnant and not know it. And so it's a very, very important safety concern. The other thing about those prostaglandins is asthmatics can have some pretty serious reactions because of the effect on the airways. So that's just an example of, sit down with your veterinarian and go through the drugs you have. And are there any special concerns? And they'll know. There's some others that you should probably know.
And then, what are some of the things, like for keeping that bottle around so I can safely use the rest of it? I'm not going to use a whole bottle in a day or even in a month.
Some of my antibiotic bottles may stay around for a year. Yep. And that brings up another point of monitoring the expiration dates and moving stuff on. And just get what you need, and don't get huge bottles at your expiration date.
Because they can, even if you go in and buy it in a clinic, they can proportion it out into a plastic bottle for you or something like that.
So the big thing with that cork is treating that cork correctly. And you'll see some people just go in with the hub of the syringe.
Yeah.
And
with no needle.
With no needle, and I can understand why, because that needle gets dull when you go through there. But if you do that in a bottle that's going to stay around for a long time, you're going to create a really big opening in that cork, and one that could possibly let bacteria get through there, the bottle become contaminated, and things dry out. So I really like, on my place, I stay just using the syringe and
But
and
you
the
always
needle.
use a new needle going into a bottle.
That's the biggest rule you could take from today, to keep those contents of that bottle pristine and ready to use again, is stored at the right temperature and the right light conditions. Always go in with a new, clean, sterile needle, and that bottle will be there for you.
Cool. Any last parting comments?
You really need to sit down with your vet on the drugs you have and how you're storing them and how you're using the needles and which ones you're using, and have a talk about that and make sure you're getting the most bang for your buck, because these things aren't cheap.
No. And as always, it's a pleasure to have you on the show. Always good information, practical information. Folks, Dr. Mike Apley from the College of Veterinary Medicine here at Kansas State University. And if you want to know more about what Dr. Apley and I do here at the veterinary school at K-State, you can find us on the web at www.vet.ksu.edu. Remember, we always recommend that you work with your local practitioner. We appreciate you watching DocTalk today. I'm Dr. Dan Thompson, signing off from Kansas State University's College of Veterinary Medicine. Thanks for watching, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
DocTalk, produced in cooperation with Drovers Cattle Network and Bovine Veterinarian. For more information about this program or previous programs, go to doctalktv.com. DocTalk was brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.